Okay, welcome back to the second part of this seminar for professional practice and placement preparation. So your first placement is a 5-week placement, and that we anticipate will be in June, and it is a full-time placement. So the other thing to be aware of is, as your course is an accelerated course, you're not entitled to annual leave. We're telling you this because BSc students have some annual leave entitlement built into their placements, and your educators may ask you because they're used to having BSc students, but you're not entitled to annual leave. So if we just have a think about placement hours and flexible working, so you're required to do a minimum of 1,000 clinical hours by HCPC, and this is required for your registration. So although this is important, obviously you need to be passing the placements to pass the module, and really focusing on the learning outcomes are the things that are going to help you develop as a practitioner. So it's not just about quantity of hours, we want quality within that as well. Most of your placements are going to be between 32 and 37.5 hours per week, but do be prepared that you may need to fit with your educator's work pattern. The NHS is a 7-day service, so you may be expected to work weekends, and certainly some services work atypical hours, so they might work till 7 in the evening. So just be prepared that you may not be working standard 8:30 till 4:30 hours. If there's challenges with this, obviously discuss it with your academic advisor and your practice educator to negotiate something that works for both. Okay, so we're just signposting the SHU Physiotherapy placement website to you. It's where you're going to find all the relevant documentation, excuse me. So it's got the contact details for your staff and all your paperwork you're going to need on placement. So if we just have a quick look at it. So it's a health and social care overall placement website for the university. If you just move down to this area, you'll find the physiotherapy tab. And then within the physiotherapy area, here are all the different areas that should cover the information you need. So what you need to do around preparation, who the providers are, what roles and responsibilities are, assessment, attendance, travel, etc., etc. So I'd advise you to spend some time just getting to know the website and find the appropriate paperwork for your placement. So if we have a think about the placement process, this flowchart just indicates what should happen prior to your placement. So we aim for between 1 and 2 months before your placement to notify you of the location of that placement. I think we need to be it's a goal and it's an aim. I'm sure you can appreciate that there's lots of complexity behind the scenes with allocation of placements to a large number of physiotherapy students, and we do get placements cancelled at last minute and have to find new providers, etc. So we will release the allocation details once all students are allocated. So sometimes this does delay the release of locations of placements, and although we understand that that's stressful for everyone concerned, we do need equity across all students in terms of knowing where they're going. Once you have got notification of where you're going, then you can look at PAR or the SHU website to find out information about that placement provider. We recommend you, as soon as you know who your practice educator is, you get in contact with them to find out things like to introduce yourself, to find out around the logistics of the placement, but also you need to share with them a mini CV and a SWOT analysis so they can start to get to know you and what you want out of the placement. There's an expectation that you'll do some pre-reading, that your placement educator will guide you through what you need to do. And in some instances, some students feel that a pre-placement meeting might be helpful to settle any sort of anxieties around the placement or prepare them fully. You are more than welcome to request that of your practice educator. 2 points, it's not a requirement, you don't have to do it. And if the service can't support it, then please respect that. So this is just signposting the PAR website to you, so it's where you'll find information about all the different placement providers in Yorkshire and Humber. Outside of that area, it is on the SHU website. Okay, so one of the tasks we asked you to do was think about what needs to happen in week 1. So these are the essential tasks that should happen in the first week of your placement. So you should have some kind of induction, whether that's at a local level or a corporate level, to introduce you to the policies, procedures of the area that you're working in. You need to sit down with your practice educator and set some objectives. It's worth doing this on your own before your placement starts, and then refining them to SMART goals with your practice educator when you know what opportunities are realistically available to you. It's obviously a settling in period for you as a student. You need to meet the staff and become familiar with the environment and caseload. It's vital during that week that you share your academic advisor's details with your educator. They both need to make an arrangement for a midway and final way placement. Your academic advisor will send you, usually via a Google document or form, their availability for both of those points. And you need to negotiate with your educator what times would work best for them. So please, this is a negotiating process, and if for any reason those times aren't useful, then get in touch with your AA to find an alternative arrangement. And we just ask if there's any concerns from yourself about the placement. It's not quite what you were expecting, or you're struggling, or something's happening at home that's impacting on your ability to attend or be present at the placement, then please get in contact with your academic advisor. The sooner you get in contact, the quicker we can sort things out for you and support you through the process. Just again, we're highlighting some changes that have happened in the paperwork process this academic year, so 1920. The reason we're doing that, again, that educators should be fully aware, but your educator might not have had a student this academic year. The biggest difference is that all paperwork needs to be completed electronically and submitted electronically as a PDF file to your SHU student email address. This is different from before, where we accepted paper copies and scanned in copies. So it's just a difference for the educators. As I say, they should be aware, and we'll go through the process from your perspective. So there's, as well as the assessment form, there is a professional competency form and an hours form that need to be completed. So this is your process. You set your weekly objectives with your educator. At midway, they'll have a phone call with your academic advisor and give you your formal feedback. And then you continue setting your weekly objectives and getting some informal feedback each week. At final way, you complete the range of paperwork that needs doing. Your educator needs to have a discussion from a moderation perspective with your academic advisor. It is a pass-fail mark for the pre-reg MSc. It shouldn't be a surprise to any student if they're failing the placement. That should have been addressed at a much earlier point in the placement if there's a risk of that happening, and we'll go through that process. Your hours sheet and your professional competency and any feedback from service users or MDT members needs to be completed. All of that paperwork needs to be converted to PDF files and sent to your SHU email address, your student SHU email address. Please do not give your educators your personal email addresses. From a data protection and management perspective, it needs to be your SHU account. You then need to upload those documents to Grade Centre on the Professional Practice Blackboard site within 5 working days of your placement finishing. If you do not do this, it's considered a non-submission and you will fail the placement. If there's any reasons why that's not likely to happen that are beyond your control, please get in contact with us again sooner rather than later, and we can work out the best way forwards with that. So we do sometimes have students that fail to progress on placement, and we have a formalised process for dealing with that and helping you and supporting you to get to that pass criteria. So it's a three-way conversation as soon as it's identified as a potential situation, and that might be because it's linked to a single incident of unsafe practice, or it might be that as a student you're struggling to achieve one or more of the learning outcomes. So we use this placement progress review form, which again you can look at on the website, and it's about setting very, very specific, small, short-term goals that are aimed at achieving the pass criteria. And as I say, it's a three-way conversation between the educator, the student and your academic advisor. And this is the form. There's a clearer version on the website. And let's just think about why. So in some cases, there's many reasons why somebody might not pass or in fact complete a placement. It could be there's personal circumstances that mean that it's not tenable for you to finish the placement, or that is impacting on your performance whilst on placement. It could be linked to some academic challenges, and translating your knowledge into the clinical setting can sometimes be quite difficult for some students, or a mixture of the two. If that's the case, you would need to redo the placement, and we talk about trailing a placement. So that's what this looks like. So we've got our normal placement blocks, and then trailing means that you would end up doing an extra placement at the end of the course. So that's how it would look. So thank you for listening. I hope that we've answered some of the questions we posed on the eTivity. For your final activity, we suggest that you start to develop your mini CV and your SWOT analysis. So think of what your strengths are, what your weaknesses are, what opportunities you see on placement or you'd like on placement, and what threats. So initially they're going to be quite generic until you know where you're going and what clinical area you might be working in. But it's a good process to start, and then you can develop that. It would be wise to share those with your academic advisor. So thank you for listening.